So this is my update after my second R-CHOP treatment. It's been a while since I made a video. It actually took a long time to get the second treatment, so I think that's what I'm going to talk about first here. So everything's happened over the past, I guess, like 5 weeks. So it's been right now 3 days since my second R-CHOP chemo session where I had to go to the hospital. But before that, I was supposed to get, they're supposed to do, for me, they had every 3 weeks planned. But what had happened for me was actually on the day before I was supposed to go in the hospital, I started getting like a little bit of a fever. And then I called on the day to go in the hospital, and they didn't have a bed free. So, instead of going to the hospital, I just took an ibuprofen and made it through that day. And then the next day, they had a bed free in the hospital, and so I was able to go in. And then they did a bunch of tests and found out I had like some kind of infection. It was super dangerous, and basically they kept me in the hospital for like a week, and they couldn't give me any chemo, and they had to give me a bunch of antibiotics to try to fight this infection. They did a pump. Basically, they pierced my stomach and drained a lot of fluid that was accumulating in my body that they thought had also been infected. And that process took about a week. And that was actually when my brothers were going to come visit me in Germany. So I missed them the first couple of days when they were still able to come and we could sort of talk a little bit. But it wasn't until kind of the end of that they finally let me go. And they let me go home for a couple of days, and that was great. I was able to hang out with my brothers and my family. And then I had to go back after that and then get the chemo like a couple of days later. So it ended up protracting that 3 weeks into like almost 4.5 weeks or something before I was able to get the second session, which I just got. Okay, so once all that was over with, they were able to, I was lucky I was able to get the infection done away with. And so then I went back to the hospital. They plugged me up back to the chemo treatment. And the way it works with the R-CHOP is you get rituximab first. And the reason I have to go to the hospital is because I had, the first time they did it, an allergic reaction to rituximab, which is just one of the medications you have to take. And so this time, I went back to the hospital. Now they told me also that they had found in my poo that that there was some bacteria that you can't fight with antibacterial drugs. So I have to, now when I'm in the hospital, I have to wear a suit everywhere I go. And I have a room to myself, which is, I guess, nice. But, anything else you want to do, you can't go outside. You have to, outside of your room, you shouldn't, normally in the hall, there's like maybe tea or something you can get, or you can get up and even go to like an exercise bike and use that. But now because of this, bacteria I've got, I can't have any contact with anyone else. I have to really watch out, make sure I, wash my hands, wash everything. I'll put on this suit anytime I go anywhere, etc. So I had to do that this time. But then they went in, plugged me up to the rituximab. They gave me a little bit higher dose this time. I didn't have an allergic reaction, so that means I didn't get a fever, and that was fine. And they gave me the rituximab over 2 days, about 24 hours really total. And that worked. That was fine. I didn't have any fever or allergic reaction. And then I had also told the doctors, because I've been having numbing on my fingers, and that's one of the side effects that you can get from these drugs is, it'll kill the nerves on your fingers. I told them that, and they gave me a little bit of a reduced dose this time so that hopefully that won't be as bad. And they then, after I took the rituximab, so they gave me those other chemo drugs, and then I was gone. So this time I was in the hospital about 2 or 3 days. I think 3 days, because I was there for 2 days getting all the chemo, and on the third day they let me out and go back home. And that was just a couple of days ago now. And so I'm still in that phase of right after you get the chemo. I don't know, for me it's always weird where I'll be extremely sleepy and tired for a couple days. But it's very odd because I'll be extremely awake and alert at other times. So for instance, yesterday I was just really tired and sleeping on and off for most of the day. And then around 10 o'clock at night, I just became extremely awake and I couldn't go to sleep till like 4 a.m. So, and then right now I'm really tired. And as you probably notice, a little blanky. on things. So I don't know how this all works. I mean, who does? But that's my side effect. So that's everything. It's basically went down with the whole chemotherapy over the past month. I'm still still trying to do stay as fit as I can. I was able to walk. I try to at least walk with my wife most days outside, get some fresh air. When I can, I'll try to even jog a little bit for about 30 minutes, work up a sweat, and do my exercises. I'm still able to do it, and it helps. I think it helps motivate me, give me some challenges to accomplish each day, and the endorphins it releases help a little bit too. So that's it for that. Okay, one of the things that happened that was kind of interesting this time when I was in the hospital is one of the doctors came to me and he said, "Hey, he asked me, can we discuss your case with some of my students in my class?" And I was like, "Sure," because I'm glad to help out, donate anything I can to science. So I went to put on my whole hazard suit to walk around, and then went to his classroom and told basically the story of everything that had led up to me getting diagnosed with lymphoma. And I was supposed to not really, mainly just describe my symptoms and try not to give diagnoses, was one of the things he told me. But so anyway, I started, with the whole history 5 or 6 years ago where, I have the chronic thrombosis, the liver problems. Then that became 2.5 years ago, fluid, etc., and then fluid on the lungs, and then the whole process of having to deal with all this, and eventually the lymphoma diagnosis, and the symptoms that led up to that, with fluid on my heart. And it was funny because every time I would say something, he would have to, because I think this was a class probably, I mean, I don't know, but it seemed like these were like third year, fourth year students or something like that. And it was probably a class on like cancer or something. And so he was always having to clarify for all my different sicknesses, like what this sickness was, and why someone would have done a particular procedure. Like when I was talking about the procedures they did for, when you have this liver problem, you can bleed out of your throat and die that way. So they have to do operations to handle different veins that might explode in your throat. And so he had to explain stuff like that. And it was just kind of interesting to see the look on all their faces, like, what is wrong with this guy? So anyway, so I'm going through that, and finally we get to the lymphoma part, and he's, you could tell even the professor's like, this guy's case is kind of crazy. I mean, this is not standard. So I think in the lecture he said, you only see with the particular type of lymphoma that I had, where there's no really lymph nodes that are swollen that you can touch, and it's also only in the like the rib cage, which is where they found it but they did find it in the bone marrow, but mainly in the rib cage. He said this is like a 1 in 1,000 case, and it's very rare to find. And he's also said, because I've got all these other symptoms too, with like fluid on my body and everything, he's like, it could be 2 or 3 different things, because there's, I have an autoimmune disease sort of diagnosed in this history. I've got the chronic liver problems that have been diagnosed, and you could just tell the doctor, he was just like, this guy, well, don't even know what to do with him. But that was kind of a fun experience. And also the students, obviously, they were just like, what do you do with someone like this? Like, how do you even take care of it? How do you keep someone like this alive? But I don't know. It was a fun experience. And that was one of the things I did that was kind of interesting when I was in the hospital. So then I walked out after that was done, they said thanks, and I, walked out in my hazard suit back to my isolated room to get some more chemo. But that was that. So another thing I want to talk about was corona. And so for anyone that has cancer, corona is one of those things that you definitely want to watch out for. I mean, I didn't really realize this, but the little infection I had, which I didn't change anything. I didn't go anywhere. I just had chemo, went back to my house, always washed my hands, everything was clean, and just got this little infection. And a little infection like that from just a normal bacteria will kill you. If they hadn't been able to give me the antibacterial drugs, and they gave me like 3 or 4 when I was in the hospital, I would have been dead from that. So corona is one of those things that if you get it, it's very dangerous. So obviously, I don't want to get it. And so I think people that have cancer or even may get nervous about this. So what can you do? And that's one of the things I have to try to watch out for now. And, we've got different variants that are coming around, and where I live in Germany, we're getting a lot more cases and everything. So, for me, I've just decided I'm just going to try to do, I guess, everything I was doing, which is avoid contact with people, with big crowds, keep the house clean, and then not, just avoid large crowds of people, don't go shopping and all that kind of stuff. And so that's what I've decided. But I think, this is something that if you have cancer right now, with the corona and everything that's going around, it's rough, I think, because it means you're even more isolated than even normal people who also have to be isolated. It's frustrating. So I just wanted to, mention that because that makes it even a little more difficult, I think. Oh yeah, one thing they told me is that because I've already had the vaccine for corona, but once you get the whole chemotherapy stuff, that basically kills off your immune system. So the vaccine is not as effective. So that's one of the things they told me. And that's something you should probably know. And then I guess that's about it. So what's coming up next? Well, what's coming up next for me is in a couple weeks, we got the next chemo. So it's a little recovery now. Then they're going to be doing the checkup to update to see if everything's working. So hopefully by the next video, we'll know whether or not everything they're doing is having any effect and whether or not it's helping kill some of the lymphoma or not. And until then, I guess it's just more party, baby, and going with the monk look, All right.